This segment sponsored by Plastic Surgery Innovations. Viewer discretion is advised. This segment may contain medical imagery before and after procedural photos that some viewers may find graphic or revealing. It is time for another edition of Inside Plastics with Dr. Joe from Plastic Surgery Innovations. Hey there, Dr. Joe. How are you?
It's good.
Good. Okay, so today we're going to talk about lip enhancement treatments. So what are ways in your experience that you see lips being enhanced?
Well, the most common way, obviously, is lipstick, which people talk about. And that's a good starting place for a lot of people. They don't need plastic surgery procedures to look good.
Okay.
Take a little bit of time in front of the mirror.
Yeah.
For some people, anatomically, they just don't have the lip that they want. And fuller lips has become big business.
Right.
Big business. The most common way that we enhance lips is probably doing lip flips for young women. And lip flip procedures are done with Botox.
Interesting.
An injection is made in the lip so that you paralyze the posterior muscles of the upper lip, which makes the anterior muscles work harder. So the lip literally turns itself out a little bit, and you see more pink of the lip. It's hence the title, lip flip.
So the pink, it shows more of the underneath lip or the inside lip?
It shows more of the inside lip. The top of the lip, the skin goes up and the mucosa comes down, so the lip turns upwards. It's called a lip flip. And it works really well for young women who have really meaty, muscular lips.
Meaty, muscular lips. That's
There
a new
you
way
go.
to think
Yeah.
about it. Okay, because I've seen like thin lips, like where they're barely there. I'm just being a lip model today. Like where they're barely there. But that is interesting that you say that just products, first and foremost, is where people should probably start. You know, I see people overdraw their lipstick with lip liner, lip gloss, lipstick, and all of that. But this treatment doesn't require you to also have to do lip enhancement through cosmetics, like a cosmetic product like lipstick. So how long does a lip flip last?
Typically about 3 to 6 months.
Okay.
For most people, on average, you can figure you're going to repeat it about every 4 months. But it's a nice procedure because it's reversible, and the complications are minimal, and it's done all over the country. The hard thing about it is it doesn't work for everybody, especially as you get older. You know, women come in and see us, and if they're in their 70s and 80s, and they want a lip flip, it's probably not going to do it for them because they're beyond the age that they're going to get that as a benefit. It's really a young lady's procedure.
Interesting. Why is that? Because you say that the Botox goes into the lip. First question, is it bottom and top?
Just the top.
Just the top, and
just the deep portion of the top lip to flip it upwards.
Okay, and that by adding the Botox, you say that it paralyzes a part of the lip and naturally makes the other part burst?
Work harder.
Work harder.
Yeah.
Okay, and so this is a young way of having a lip structure?
Yeah, it's a young person's way to enhance your upper lip.
So why is it that older women cannot?
Their lip tends to be too long and their muscle too thin to get an adequate flip. So when people come in and request a lip flip, you know, I always tell people you pay for the treatment, you don't pay for the result. It doesn't work for everybody, but for the people it does work for, they're really happy with it, and it's very commonly done.
And so what is the cost of a lip filler?
It's about $100, not a filler, but a lip flip. Costs anywhere between $100 and $200, depending on how much Botox products use to achieve it. And a lot of people will do it in combination with Botox treatment for other things, forehead wrinkles or lines between the brows or crow's feet. And so they get their lip flip. That's just part of the regular cyclic Botox treatment.
Okay, so lip flip is a younger thing. Then there's something that's called a lip filler, and that can be for all ages?
All ages.
Okay, now what is a lip filler?
Lip filler is a product that's injected in the lip, and the most common one used is a product called hyaluronic acid, which is part of what naturally makes up skin, and it's synthesized, and it's injected 1 cc syringes, typically in both the upper and lower lip to enhance the lips.
Oh, okay, and so I didn't realize it was hyaluronic acid. I put that on my face with my face cream.
There you go.
So how long does that last?
Typically, injections in the lip will last anywhere between 6 and 18 months.
Okay, so a longer
time.
hold.
Yeah.
Does it give different results than a lip flip?
Yes, it's like blowing up a balloon. So it actually volumizes the lips. It's very popular. It's one of the most searched topics online right now. In this country, on average, about 1.4 million women a year get lip fillers.
Wow.
Yep.
That is a lot.
In the world, more than 2 million women a year. And it's very popular among all ages.
And so when they get the lip filler, how much is that?
One syringe costs, in my office, about $650.
Okay, so it's a more expensive
More expensive.
procedure, but it lasts longer, and it gives, you could do top and bottom to expand the lip. Wow. And is that hyaluronic acid filler the same thing that's used when people get fillers in their face?
Same thing.
Huh.
Yeah. The one thing I warn people about, because lip fill has become very popular. You walk around, a lot of young women now have bigger lips because they're getting fillers. There was a nice study that was recently done, and they used middle schoolers as the judges.
Oh, wow.
And they showed pictures of the patients, which were mostly women, before and after treatment. Some of the pictures were real treatments. Some of the pictures were computer simulations, AI. And then they asked the kids to rate whether the person was more attractive or less attractive.
Okay.
All the patients who received just a single syringe, one syringe, were judged by the kids to be more attractive.
Than
the original.
Oh, than the original.
The original picture.
Okay.
But by the time somebody had it filled a lot, all the people that had 4 syringes, either real treatments or simulated, were judged by the kids to look worse.
Yes.
So what I always tell patients is, go slow, do one syringe, and then if you want another one, do another one. With the models, with the experiment, some people still look better after 2 syringes, and some people look good after 3. Nobody looked good after 4. So somewhere between 1 syringe and 4 syringe, you've blown them up too much.
And what is the frequency? Like after someone gets it done, when can they come back if they want a second syringe, for example?
Most of the time we'll have people wait at least a week or 2 for the initial swelling to go down.
Yeah, I think I have seen, especially on reality shows, it's like those women can't stop. They're addicted. They're like, give me more, and their lips are just like, and it is not cute.
A little bit is attractive. It's kind of like makeup. A little bit is good. Too much is too much.
It's too much. Okay, so something else that you offer. So we talked about the lip flip. We talked about the lip fillers, but you also offer a lip lift.
A lip lift is commonly used for treatments in older women.
Okay.
Once they're getting into the age where they're thinking, do I need a facelift or not? 70% of the changes of aging have to do with the region around the mouth in one of the studies that was recently released by American Society of Plastic Surgery. And so the lip is one of those areas that we didn't pay attention to when I first started training 30 years ago, 40 years ago now. The lip lift basically makes a small incision up underneath the nose that hides in the creases and takes the lip and actually pulls it up. And so by doing that, you expose your teeth more. Sometimes older women will come into my office and they'll want filler in their lip. And I warn them, the problem is if you get filler, it blows up the lip. But if it covers your upper teeth, even though your lip is fuller, it makes you look older. Because naturally, when you open your mouth, we want to see your teeth. We want to see those pearly whites. When you smile, we want to see your teeth. And so filling the lip doesn't solve the problem if your lip's too long.
Because it'll kind of like droop down, you're saying.
It droops down.
So do you recommend that they are to get a lip lift and then a filler?
Typically what we'll do is do a surgery, we'll do a lip lift, and then instead of using a artificial filler, like we use in people walking in and out of the clinic, we'll actually suck a little fat from an area and we'll inject fat into the lip.
Fat in the lip?
Fat is,
What?
yeah. Fat makes a really nice filler because nobody's allergic to their own fat. And fat has the potential of lasting permanently.
Wow.
About 65% of the fat that we transfer to the face will last beyond 3 years.
Wow.
And for some people, it's permanent. So we have to be more careful with fat.
Right, yeah. Because it's like, where do you get it from? Is it a certain type of fat that's the right texture for lip?
Most people have a little pocket either on their inner thighs or around their belly button where we can take a little bit of fat and inject it.
That is so fascinating.
Yeah. Make tiny incisions on the corners of the mouth that no one sees, and then take a blunt cannula and plump up the lips.
Well, we are learning so much with you, Dr. Joe, so we appreciate you coming in and breaking it down.
Some people still will absorb the fat. I've injected fat in the lips of patients, and they'll come back in 6 months and they'll go, none of the fat stayed. And we'll look, and maybe a little bit of it has stayed, but not enough to make them happy. So the other thing that we use is we use lip implants.
Okay, yes. I've actually seen that before. I knew someone that had a lip implant, and they were like touching. I was scared, and it's so hard. Like, doop, doop.
That's the disadvantage of using implants, is that people sometimes can feel them and other people can sometimes feel them.
Yeah.
But a lip implant never absorbs, never goes away.
So it's
never
permanent.
has to be repeated.
You don't have to. Okay.
Yeah.
Interesting. Okay, so we got our lip flip, lip filler, lip lift, and then a lip injection with fat, and then a lip implant. Whew, there's a lot of lippy stuff happening here, and you just broke it all down. Thank you, Joe. And if you would like more information about plastic surgery innovations, the services that we talked about, and so much more, you can give them a call or visit their website to set up an appointment. And I'll see you after the break. This segment sponsored by Plastic Surgery Innovations.